So the CROWN program was established to help patients that have been recovering from COVID obtain resources to help them get post-COVID care throughout the Northwell organization. In Staten Island University here, we've started a clinic, the Post-COVID Recovery Center, specifically to address the complaints that patients might have related to COVID itself. So typically we're taking care of patients that have had COVID in the past, have been exposed to COVID, or potentially were just even afraid that they were in contact with COVID without a proper diagnosis. Classically, we refer to COVID as being fever, cough, shortness of breath. But unfortunately, we found out as time has passed that there's actually a lot more to those symptoms than we thought early on. And we do have lingering symptoms long-term with some of these patients that are sometimes only nagging complaints, and sometimes they can actually be quite debilitating long-term. Sometimes even these patients don't necessarily have any symptoms after COVID, and they think they've entirely recovered fully, and they'll come back to us with strange things like heart attacks or strokes, fatigue, rashes, numbness and tingling to all parts of the body, other skin changes, hair loss, the loss of the sense of smell that they were otherwise low risk for, except for this recent history of having been exposed to the COVID virus. So the program itself has a structure that's kind of all-encompassing, one place, one time approach to managing these COVID symptoms. So typically throughout the patient visit, you'd be examined by myself from the medical perspective, and I also have specialists here available within a clinic either in person or via telemedicine. Telemedicine is an available option if a patient is afraid to come in person. So while here every patient would be seen medically, they would also undergo a neuropsychiatric evaluation and also a physical therapist evaluate their functional status here. We don't necessarily follow patients that just got diagnosed with COVID. In this setting, we're seeing patients that have had at least 2 weeks since their diagnosis of COVID, since at that point we're presuming that their viral loads are non-existent. So we have multiple doctors in our network here that are all coming together to help us with this clinic. If I were to need, say, a hematologist because of clotting phenomenon that occurs with COVID, I can actually have a hematologist conference in during our visit. So this program itself is designed partially as a way to treat patients and also partially as a way to investigate and follow these patients long term. So our goal here is to track patients to look for problems that might have arisen from the acute COVID infection that might have been missed prior. So complications that arise, say a month or 3 months down the line, can be followed here specifically to address those problems as they come up.